Day 1. Here are the identified problems from the initial database. Number 1. Pure environmental sanitation. Presence of breeding or resting sites of vectors of diseases. Subjective. Problema po ang dikit-dikit ng mga bahay. Maraming ligaw na hayop at medyo maruming paligid kasi minsan nangangati kami at yung bunso ay may allergy, rhinitis. Nagwawalis po kami at nililinis yung harap ng bahay kapag may dumi pero hindi rin sapat dahil sa dami ng hayop sa paligid. Sana po makausap yung barangay para may mga projects for stray animals pati na rin yung mga dumi nila. Parang kanya-kanyang linis lang po ang mga tao, hindi para sa kabuuang kalinisan ng buong lugar. Busy po ang parents namin at bilang mga estudyante, madalas wala kami sa bahay kaya hindi agad nalilinis ang paligid. Yung ibang miyembro ng pamilya po, madalas din tamaan ng ubo at sipon. Minsan po, nagkakainitan na ang mga tao sa loob ng bahay kasi hindi na nakakayanan ang dami ng kalat sa paligid. Objective. The family lives in a congested neighborhood and many stray animals like cats, dogs, and chickens. Common illness recently encountered include rhinitis, allergies. Number 2. Accident hazards, fall hazards. Subjective, problema po ang madulas na sahig lalo na kay Lola kasi minsan talaga po ay nadudulas siya sa tiles. Ilang beses na po may nadulas sa may hagdan, halos 3 beses na po kaya delikado talaga. Walang sapat na budget kaya hindi pa po naipapaayos ang mga delikadong bahagi ng bahay. Hindi rin po ito priority ngayon lalo na't wala ang mga magulang. Plano po ni Papa lagyan ng rubber mat yung sahig pero hindi pa po natutupad. Minsan nadudulas pa rin po kahit may basahan lalo na kapag basa ang sahig. Delikado po talaga kasi mahirap ang akyat baba sa hagdan lalo na para kay Lola. Nakaka-frustrate po minsan kasi hindi lang delikado kundi nakaka-istorbo rin sa araw-araw na gawain lalo na't nasa itaas ang lahat ng kwarto. Objective. There are steep stairs and slippery tiles in the home. The grandmother could be affected because she is already old. Okay, so this is day 2. Problem. Pure environmental sanitation, presence of breeding or resting sites of vectors of diseases. Number 1, inability to make decisions with respect to taking appropriate health action due to G. Lack of community resources for care. Problem. Accident hazards, fall hazards. Number 2, inability to provide a home environment conducive to health maintenance related to A. Inadequate family resources, specifically limited financial resources. Okay, so day 3. Accident hazards, fall hazards. Goal of care. After 1 week of nursing intervention, the family will be able to perform measures to reduce the risk of fall accidents in the home environment and protect the elderly grandmother from injury through affordable and sustainable safety measures. Okay, so last day. Evaluation. Goal met. The family was able to define accident hazards, identify 3 common hazards in their home, and explain the increased risk for the elderly. They also described at least 3 safety actions and demonstrated 2 low-cost safety practices, including the use of non-slip mats and a hazard monitoring log, all within 1 week. Recommendations. Accident hazards, fall hazards. During the course of implementing the nursing interventions for fall prevention, several strengths were observed. The granddaughter demonstrated consistent active participation and a strong willingness to learn. She showed enthusiasm in applying the safety measures taught and even took the initiative to monitor the fall prevention lab regularly. Adequate teaching aids and visual materials were used, which helped enhance understanding and engagement throughout the health education process. However, one of the notable weaknesses of the intervention was the limited involvement of the elderly grandmother, the main beneficiary of the plan. Since the teaching was primarily directed toward the granddaughter, it was difficult to ensure direct behavioral change in the grandmother's daily routines. This lack of cooperation presented a barrier to fully implementing safety practices, especially those requiring the grandmother's initiative or compliance. To improve this aspect, future interventions should involve more direct engagement with the target individual, possibly through modified teaching strategies that consider age-related learning styles, or by scheduling a time when the grandmother is available and more receptive to participate. During the implementation, certain problems were encountered. The most prominent issue was scheduling conflicts, which resulted in delays in conducting home visits and health teaching sessions. These disruptions sometimes affected the consistency of follow-ups and slowed down the reinforcement of new practices. To prevent similar issues, it is recommended to establish a clear and mutually agreed upon schedule from the start, ensuring that both the nurse and family members commit to the timing. Setting reminders and offering flexible options for follow-ups such as short visits or coordinating during existing routines can help maintain regular contacts. To maintain and improve health, the family is encouraged to continue using the fall hazard monitoring log and regularly inspect the home environment for any new risk. They should also reinforce communication among household members, especially involving the grandmother in simple safety routines and gradually building her cooperation through positive reinforcement and patient engagement. For future nurses who may continue care with this family, it is recommended to explore deeper ways to build rapport with the elderly members number, perhaps through more culturally or generationally appropriate methods. Furthermore, issues such as home lighting conditions and uneven flooring, which were identified but not fully addressed due to time or resource limitation, should be reassessed and incorporated into future intervention plans if still present. Close collaboration with barangay services may also be useful in sustaining long-term fall prevention measures.